If you are ever in an emergency and you need an ambulance, the last thing you should be worried about is the cost. And that's why we've got health insurance, right?
Yeah, you would think, first thing that comes to your mind. But for the last couple of years now, CBS News Texas and the I-Team has been shining a light on a little loophole in federal law that makes insurance basically useless for most ambulance rides. Investigative reporter Brian New is joining us live from Carrollton. So today, federal committee meets to address the very issue. This has been a long time coming.
Yeah, it sure has, Doug. This advisory committee met for the very first time today. There was a lot of discussion about the cost of an ambulance ride, the billing, and who should pay for what. This committee now has 6 months to come up with recommendations to Congress so that patients are no longer surprised by ambulance bills.
When 5-year-old June pretends to be at the hospital,
Is good?
Yes.
it's easy for her mom to smile.
But you gotta stay in the tuck for a little bit longer.
But when the situation was real,
All of a sudden, we heard kind of a crash from upstairs.
Rachel Metzger says it was scary.
Yeah, she wasn't waking up. It was really scary.
June had fallen from a bedroom loft, hit her head, and was unconscious. The Metzgers immediately called 911. An ambulance rushed June 5 miles down the road to the hospital. There, she was diagnosed with a concussion. Doctors told her parents she would be okay. For the Metzgers, the stress of it all was over.
So these are the bills.
Or so they thought.
When I saw that it was $1,000, I couldn't believe it. I thought
The Metzgers have health insurance, but Austin Travis County EMS does not have a contract with any private insurance company, effectively meaning all of its ambulance services are billed out of network. For the Metzgers, that means they're on the hook for $1,082 for the 5-mile ride to the hospital.
And I assumed that once they ran things through insurance, then everything would be fine.
Was it?
Nope. No, it was not.
Every year, 3 million insured Americans are taken to the emergency room by an ambulance. Studies show about half of those patients end up with a surprise medical bill. In Texas, it happens even more often, 70% of the time. These out-of-network ground ambulance bills cost Americans $129 million a year.
Circumstances like this that can set families back for years.
Patricia Kelmar with the Public Interest Network has testified to Congress as a patient advocate. She says when lawmakers passed the 2020 No Surprises Act, it prevented hospitals and doctors from sending patients unexpected out-of-network bills. But the law doesn't require the same for ground ambulances.
We really need to solve this. It's not fair if you're insured that there's a good chance you can't even go in network for an ambulance.
Lawmakers said the ambulance industry was too complicated to include it in the law because while some ambulance rides are provided by private corporations, most are provided by local government agencies. In Dallas, it's Dallas Fire Rescue. In Fort Worth, it's MedStar.
What would happen to ground ambulance services if they were included in these bills?
Matt Savasky of MedStar says if local government-run ambulance services could only collect what insurers are willing to pay, either local taxes would have to go up to make up the difference, or their services would have to go down.
And I would argue that if the community wants to have an ambulance at their heart attack, at their car crash, at their baby not breathing, within 7 minutes with a high degree of reliability, it costs a lot more than $500 to do that.
Ambulance providers and insurance companies both say patients should not be stuck with surprise bills. But since the two sides can't agree on fair pay, it's patients who are paying.
In my mind, they should work with insurance the same way that any other healthcare provider does.
After unsuccessful attempts to negotiate, last month the Metzgers began making monthly payments on their ambulance bill. June will be nearly 8 years old by the time they pay it off.
It feels bad to feel like you're getting ripped off by these people who are supposed to be providing you life-saving services.
So this advisory committee, which was set up as part of that 2020 No Surprises Act, will meet again tomorrow. Doug, Karen, this committee by law has just 6 months to come up with their recommendations.
So Brian, you just mentioned a committee was set up as part of the 2020 No Surprises Act. We know we had COVID obviously that year, but here we are 3 years later and they're just meeting for the first time. Any idea why it took so long?
Yeah, that's a good question. It's a point of frustration for many consumer advocates because while the committee has just 6 months to come up with their recommendations, that clock doesn't start until they meet for the very first time, which was today. Now, we have asked the Department of Health why it's taken so long to set up this first meeting. They have not answered that question.
So, Brian, based upon what you've heard today, do you think this committee coming up, do you see them coming up with a solution that will protect patients from these surprise ambulance bills?
Yeah, it's hard to say, Karen, from just the first day. We heard from both the ambulance industry and the insurance companies today. A lot of them made their presentations, and they both said that they want to take patients out of the middle of these bills. But how? That's the big question, and one that was not answered, at least on day one.
All right, brand new, getting us up to speed out of Carrollton. Thank you, Brian.